Hi guys, in this video, we're going to talk about a simple concept in the respiratory system, which is the anatomy of the diaphragm. So what does diaphragm mean? It means a structure that separates between two cavities. So our diaphragm is that muscular structure or musculotendinous structure that separates the thoracic cavity from the abdominal cavity. And this is actually the muscle of respiration. With contraction of diaphragm, we breathe. Now, it has two parts. It has a muscular part and a pneurotic part, or the tendinous part. The muscular part, it has bony attachment. So think about the bones around you. If I want to attach this reddish structure, the muscular part, to the bones around me, where would I go? I have sternum, I have lower costal cartilages, and I have muscles at the back, and I have the lumbar vertebrae. So in order to attach myself to the surroundings, I'm going to give the names of the attachments based on where I'm going to get attached. So I have a sternal part that attaches the sternal part of the diaphragm to the lower part of the sternum and xiphoid process. I have costal muscular part that attaches the diaphragm to the lower costal cartilages. I have lumbar parts that attaches the diaphragm through ligaments to the structures in the posterior aspect, and these ligaments are going to be called based on where they are. I have a lateral arcuate. Arcuate means it's like an arcuate. It's like an arc, okay? I have lateral one, I have medial, and I have median. So the lateral is what overlies the quadratus lumborum muscle. The medial is what overlies the psoas major muscle. So these are all attachments of my diaphragm. And the last ligament is the median, which is in the center. It's basically the ligament that attaches the right and left crura of diaphragm. What is the crura? It's actually those tendons that arise on the right side from L1 to L3, and they are kind of making sling-like fibers around the aorta. All right, and the right and left crura, they connect together, and from the right cross of diaphragm we have also muscle slings that wraps around the esophageal hiatus to act as physiological sphincter. More information about that is covered in the digestive module. All right, so when I have a ligament that connects the right and left crura of diaphragm, this is the median arcuate ligament. All right, so by these attachments, I'm going to have my bony attachment of the muscular part of the diaphragm. However, the tendinous or the apneurotic part in the center, they don't have any bony attachments, and these are basically in the center of the diaphragm. All right. Now, the important thing here is the openings that we get to see to transmit the structures between the thoracic cavity and the abdominal cavity. We have the caval opening, we have the esophageal opening, and we have the aortic opening. How will we remember the levels of them? T8, 10, 12, Voice of America, V for the caval, because that transmits the inferior vena cava. Of is the esophagus. This is in the muscular part of the diaphragm at the level of T10 that transmits the esophagus, and then the America is the aorta. It's actually an opening behind the two crura of diaphragm. We don't consider it as an opening within the diaphragm. It's basically behind. So this is the aortic opening. Okay, you guys need to know, where do we get to see this opening? Remember that the caval opening is in the tendinous part. The esophageal hiatus is in the muscular. Esophageal has a letter S, so this is in the muscular part. The caval in the apneurotic, they don't have S. In the tendon, this is the opening. However, the aorta, it's behind the diaphragm. It's not within the diaphragm. We cannot have the aorta transmitted through the diaphragm, because you guys know that the diaphragm keeps on contracting during breathing, and I cannot keep on compressing the aorta with its high blood pressure. All right, so it makes sense that the abdominal aorta is actually behind the diaphragm, the aortic hiatus, and by that you know the levels of these openings. So remember that the caval opening in the aponeurotic part is esophageal with S in the muscular, and the aorta is behind. We need to know some of the structures they go through these openings. Remember that vena caval, V, you pronounce V by making your lower lip to meet your teeth, upper teeth. Phrenic is the same. So inferior vena cava, sometimes the right phrenic passes through it, and I will show you another cadaveric photo to show you that concept. So it transmits the right phrenic, and then esophagus, what runs with it is the vagus, so S and S. All right, so the esophageal hiatus, we have the right and left vagal trunks. They come out to the abdominal cavity through the esophageal hiatus, and through the aortic one, remember the ATA structures. It's other than the aorta, the thoracic duct, and the esophagus vein. So ATA structures, the ATA structure. Okay, so caval with phrenic, esophagus with vagus in the muscular part, and then the ATA structure, the aortic hiatus, the thoracic duct, and esophagus. All right, so this is T8, and this is at the level of T10, and this is at the level of T12. Now, moving on, if you guys look at this nice cadaveric photo, you have the right and left phrenic nerves. The phrenic nerve runs in front of the hilum of the lung, and sometimes the right phrenic comes out from the caval opening. Can you guys see the vena caval opening in the diaphragm, in the tendinous part of the diaphragm? All right, and this is the esophagus. And then if I were to show you here, here is the esophageal hiatus, and this is the aortic opening. Okay, on the real cadaver photo. So back to this picture. So you have right and left phrenics, and so basically the right phrenic sometimes comes out from the caval opening. Now, what about the innervation? The diaphragm is mostly innervated sensory and motor by the phrenic. However, it can also receive the peripheral parts of it, sensory innervation, from the lower 6 intercostal nerves. All right. What about the lymphatics? It's quite simple and easy. The diaphragmatic nodes is what drains the lymphatics from the diaphragm. We have 3 groups: anterior group, posterior group, and lateral group. If you are draining from the anterior group, it needs to drain into the parasternal lymph nodes. If you are in the posterior group, you're going to drain into the posterior mediastinal. However, the lateral group drains into 3 of them, both of them, plus the brachiocephalic nodes. Eventually, these nodes need to drain into the bronchomediastinal trunk, because remember that the idea of the lymphatic system, like we said in the overview of lymphatic system, it needs to be lymph nodes draining into trunks, and then if you are on the right side, you drain into the right lymphatic duct. If you are on the left side, you drain into the thoracic duct, and eventually you would drain into the angle, which is the junction between the internal jugular vein and the subclavian vein, and then to the heart. All right, so these are the group of lymph nodes. And when we talk about structures in the thoracic cage, we are talking about the bronchomediastinal trunk. Okay, so remember the name of the trunk that drains the area where you're studying, and then you will know your pathway all the way to the end, to the heart. With that, so we are done with this. Thank you guys for watching. Don't forget to like and subscribe, and see you in the next concept.